does stress translate into physical pain like headaches? Is it muscle tension, nerve irritation, or something actually happening within our nervous system?
It's actually a combination of all of those things. So that's a great question. What's happening when our bodies get stressed is we are actually experiencing what we call fight or flight syndrome. And fight or flight simply happens when your body goes into this extremely stressed mode where the digestive system decreases in its activity, the muscles tense up and tighten. And what ends up happening is that as the muscles tense and tighten, if that goes on for an extended period of time, that can actually start to irritate the nerves and the pathways that go to different parts of the body.
Hmm. Hmm. And for African Americans experiencing these headaches 2 to 3 times a week, and then we say, "Oh, this is just normal, like my head is just hurting." Is that really normal? Or when does it get to a point where we say, "Hey, this actually needs to be checked out"?
That's a great question. It actually needs to be checked out if it's going on for longer than about 15 days in a month. So we're talking about half the month, 2 weeks. And even though something is common like headaches, it doesn't necessarily mean it's normal. We shouldn't be experiencing headaches on a regular basis. If they're happening for more than 15 days within a month, we consider that chronic, and a person definitely needs to be checked out.
Hmm. And what are some daily habits that may be contributing to these headaches? If someone says, "Hey, I do have it more than half of the month. Like I feel like I have a headache literally every other day, multiple times throughout the day." Is it posture? Is it hydration? Like what can be contributing to why people experience these and other people don't?
Well, the most common headache that happens is caused by tension and stress. So, stress is always the number one factor. It manifests in our bodies in specific ways that we talked about with tension and things of that nature, but also poor sleep. Poor sleep will lead to increased stress, increased tension in the body. So we have to make sure that our sleep is well, and also dehydration, as you mentioned. If the brain is not properly hydrated, if the rest of the body is not properly hydrated, then headaches will just abound.
Hmm. Hmm. And 87% of migraine sufferers report seeing a chiropractor to treat their headache pain. What are some of the techniques that you're using to help these people?
Well, what we actually do is the area in the upper neck, a lot of tension and stress built up in the upper neck area. Those nerves, there are a lot of nerve pathways, especially in the upper neck area, that go to other areas of the brain, the head, the face, the ears, eyes, nose, and throat, which is why people experience headaches. So, chiropractic, what we do is we focus on adjusting that upper neck area and adjusting that part of the spine and increasing the spinal biomechanics and the motion, which actually will take the tension away from that area, which will also lead to decreased stress response and then also less tension.
Hmm. Now, there are some concerns with some spinal manipulation, right? So, how do you address those concerns?
Well, the good thing about this has been studied multiple times. Harvard had a study recently where they basically said there's actually no causation between a spinal manipulation of the neck and any kind of adverse events. However, there is risk involved, just like with any specific procedure. So, if a person comes into my office, a patient comes in and they ask me, "Hey, is this something that we can do?" We make sure we do a thorough evaluation, consultation. We take X-rays. We check all of their health history to make sure that there are not any limiting or risk factors involved in them getting those specific adjustments to help with that upper neck pain leading to stress and headaches.
And if you've had patients that come to you and they've done the manipulations and they've tried to do the hydration and changing of daily habits, when do you finally say, "Hey, we need to actually maybe look into a neurologist"? Are there any signs and symptoms that point you to saying we need to go and escalate and think of other areas of intervention?
Absolutely. If a patient is not getting better after, an initial period of maybe 4 to 6 weeks, we would refer out to a neurologist just to make sure they're not experiencing any other type of situations, any syndromes, any type of diseases or underlying causes that may have not been addressed properly. Because we look at a lot of different things, but we are trained to know that, hey, this person needs to be referred out for a further neurological evaluation, orthopedic evaluation, because there are some people that do not respond to the chiropractic care. There's very few people, but if they don't respond to it, we know when to refer those people out to get some further studies done.
Mhm. And if someone is watching right now, they say, "Hey, Dr. Bowler, I I have these chronic headaches. It's interfering with my personal life, my work life. I can't sleep at night. What are some three practical things that you would tell them to start to help them to treat themselves at home? And if not, how can they find you so that you can actually get some therapeutic measures on board?
Absolutely. The first thing I would tell them to do is watch their posture, watch how much time they're spending on their phone, their mobile devices. Practice putting their ears over their shoulders so they can make sure that their posture is good. Second of all, I want them to make sure that they're going to sleep and sleeping properly in the bed, making sure they have a proper sleep position, there's proper temperature there, and make sure they're getting enough sleep. And then the third thing I would tell them to do is that they work at a desk or have an office type of job. I would tell them to get up and move around every hour. They have to
Mm.
make sure that their body is moving around so their circulation is good, the tension stays down or minimized, and that they can actually, address these issues that way.
Moving and sleeping.